Hey everyone, I hope you find a lot of value in my videos so far, and this one's getting into what can be done to improve the strength, stability, and pain-free mobility of your ankles. If through your life you've been prone to ankle injuries, maybe you've sprained your ankle a number of times, or maybe you've just been having ankle pain with activity lately, well, today's video is the one for you. Unfortunately, ankle pain can be very debilitating and really restrict one's quality of life, but there's a lot that can be done with physical therapy to address this condition. That's what today's video is all about. I hope you find it really helpful, and if so, please subscribe to my channel. So the first thing to understand about the ankle is that there are 4 different directions to the ankle: plantar flexion, dorsiflexion, inversion, and eversion. Plantar flexion, dorsiflexion, inversion, eversion. Again, plantar flexion, dorsiflexion, inversion, eversion. All right, so why are the 4 directions of the ankle important? So it's not the plantar flexion or the dorsiflexion that's going to add more strength and stability to your ankle. If you're already walking and you're already fairly active, when we walk, we use plantar flexion for pushing off, and we use dorsiflexion for clearing the ground. So those 2 muscle groups that are responsible for those actions are usually pretty strong and pretty stable. It's actually the inversion and the eversion of the ankle that is normally weak and that usually causes the instability to the ankle. So if we can strengthen these 2 different directions and the muscles that are associated with these movements, it'll really help to add a lot more strength and stability to your ankle and really help to address your issue. So again, the 4 directions are plantar flexion, dorsiflexion, and most importantly, inversion and eversion. If you're starting off and your ankle is quite painful, meaning pain more than a 5 at rest, you may just want to work on inversion and eversion back and forth for range of motion and pain management. If pain is less than a 5, I'd recommend using some form of resistance. The best resistance that I've learned in my career is a TheraBand. All right, so when using TheraBand resistance to improve the strength and stability of the ankle, first we want to place the leg up that we want to strengthen with a TheraBand tied comfortably around the foot. Then we place the other leg about 6 inches away to be used as a fulcrum, kind of an intermediary between the band and the other foot. From there, what we're trying to do is swoop down and out. Okay? This swooping down and out motion is called eversion. And eversion is a big part of adding strength and stability to your ankle. Now, again, we're trying to do this swoop. We're not trying to do what I call a windshield wiper, just back and forth, back and forth. That will not add much strength and stability to your ankle. Instead of that, we're trying to do a swoop again. You can make it a circle when you swoop, or you can just swoop out and swoop back. Whatever works best for you. But it's important that we're getting that particular motion if we want to improve the health and function of the ankle. Okay, so to strengthen inversion with resistance, first place the leg up that you want to strengthen, then cross the opposite leg over that leg, about 6 inches below the knee. Then you're taking that band and you're putting it around the arch of the foot that you crossed over. What this does is allows that foot to serve as the fulcrum so that you can move your foot inwards towards that inversion position that I keep describing. So in. Okay. In as you go. You can either make it into a circle or back and forth, whatever you like the most. So wrapping in. If you're finding that the band is cutting into the foot, what you can also do is open that band up so that it's a broader surface contact area And that can make it much, much more comfortable for the foot so that it's not digging in so much. So that's another option. Always working on sets of 10 to 15 repetitions, 2 sets, 2 to 3 times a day if you're having pain. And also the pain rules. No pain past 5 out of 10. No pain lasting longer than about a minute when you finish the exercise. So today's video has been all about what can be done to improve the strength and stability and pain-free mobility of your ankles. But there are so many different topics I could post about. It all just depends on what you guys would like to see. So please post your comments below and subscribe so I can do my best to create a meaningful video for you or a loved one to improve quality of life. This is Dr. John Mayo, physical therapist, really hoping that this program is helpful for you or a loved one and improves your life.